Yeah. Well, good afternoon. My name is Dr. Orum. I'm here with Lexie Beer, who is the Director of Outreach for Keck Graduate Institute School of Pharmacy and Health Sciences. And today we're going to talk about the Doctor of Pharmacy, or the PharmD program here at KGI. One of the things that I wanted to reference prior to get into the details of the Doctor of Pharmacy program, represented by the golden hexagon on the left side of the screen here, is that there are many other programs at Keck Graduate Institute. And the exciting thing about this slide is not only that we've got the Doctor of Pharmacy program, but we've got, the Master of Business and Science, Master of Engineering and Biopharmaceutical Processing, the genetics programs, both in genetic counseling and genomic data analytics, and the post-bac programs in the pre-medical certificate and the pre-PA certificate, along with a PhD in applied life sciences. But there's also a number of summer programs, which we'd like to talk about a little bit later, where you can get a preview of the Doctor of Pharmacy program in the PrEP program, which will be offered the summer of 2022. The other really exciting thing about this slide is that it's pretty soon going to be needing to be updated. We are in the process of developing new programs in physician assistant, and that would be Master of Science in Physician Assistant Studies, and then also the OTD, or Doctorate in Occupational Therapy. And those new programs will begin in August of 2022. So we will be updating this slide, but I wanted to show that the Doctor of Pharmacy program is not a singular program at KGI. And in fact, our students who are in the Doctor of Pharmacy program have the opportunity to interface with not only students, but faculty from other programs. They work on projects together, and it enriches their PharmD experience and curriculum. So I just want to show the Doctor of Pharmacy program in context at KGI. So as I mentioned before, again, what we'll explore today is a Doctor of Pharmacy program, and then also we'll talk a little bit about the summer program and share what we know about that and how you can participate in the summer of 2022. So for the overview for the Doctor of Pharmacy program, it is designed to provide for the education of pharmacists to serve the needs of individual patients, the healthcare system, and the bioscience industry. And I would say that we have never seen this like any time in this past couple of, 16 to 18 months of the COVID pandemic, where pharmacy students and pharmacists were serving the needs of individual patients by administering vaccines and COVID tests, the healthcare system by storing and distributing vaccine, and the bioscience industry by participating in some of the testing that had to occur prior to the vaccines being distributed and administered. And as we go on throughout the pandemic, we would only expect more engagement from pharmacists, that we are not individuals simply behind a counter, but we are in front of the counter, we are out making negotiations with other members of the healthcare system, and we are also in the laboratories and in the experimental settings of the bioscience industry. And as such, our program emphasizes interprofessional collaboration. None of these things can be accomplished if we only speak with other pharmacists. We have to work with other health professionals, physicians, nurses, physician assistants, physical therapists, social workers, any number of individuals to make this happen. Also systematic problem solving, which is important. We are not just pill counters. We need to solve problems. We need to come up with solutions. And the safe, efficient, and ethical use of technology and biotechnology. Of course, we often are the owners of the medical records. And then finally, personalized patient care, which is a nod to the field of pharmacogenomics and how someone's genetic makeup can influence which medications may or may not be the best choices. So what do pharmacists do? And this is what we affectionately call this our wheel, or the wheel, but the real title is the pharmacist patient care process. And it is simply that, it's a process. It's never ending when pharmacists are engaging with patients. In other words, when a patient comes into the pharmacy, for example, we immediately start collecting data. We collect the patient's prescription, we ask for date of birth, we ask for insurance information, etc. And then we look at that prescription and assess whether or not this is the correct drug, the correct thing to do. And we work together with the physician or whomever has written the prescription, and we formulate, we're part of the plan, right? And the plan is we fill this prescription and then we give it to the patient. But in we giving the medication to the patient, there's also part of it where we are implementing the patient care process. In other words, we need to counsel the patient. We need to advise the patient about any drug interactions. We need to advise the patient on any side effects, storage requirements, whether to take the medication with food, without food, and then follow up with, if you have any questions, please contact me, contact us again in so many days, we'll reach out to you, and the cycle starts all over again. And this is, I explained it in an outpatient setting, but it also can occur in the inpatient setting. And if you look at the blue wheel in the center of the, between the patient-centered care and the multicolored wheel, what we do is we collaborate, communicate, and document. That's primarily, those are the three main functions that we must do to provide patient-centered care. So the patient is at the center, and the reason why we are doing these things. It's not for us, it's for the patient. And this is why it's really important for us to identify the best individuals for pharmacy school, because this is an ongoing process that involves significant trust and commitment to accuracy and empathy for our patients. And here are some images of some of the pharmacists in action. And this is what I want to emphasize here today is, pharmacists doing many various tasks. And our role in the healthcare system is beyond simply providing medication to a patient. Even though that's very, very important, how we provide it, the patient education is important, and to make sure that we have quality processes. So in the first picture there at the upper left-hand corner, you'll see a pharmacist administering a COVID vaccination. And this is not unusual now. People can go to any drugstore and get any number of vaccines. In fact, in the state of California, Governor Newsom just signed into law that pharmacists can administer any vaccine for patients 3 years or older that is an FDA-approved vaccine. So not just COVID vaccines, but also other vaccines as well. Below that picture, you see an individual in a pharmacy, and you see her standing in front of the medications, which means that she is more of that person that's a resource to offer information about those medications. The center picture is of a pharmacist in the hood. And of course, we would not have so many items in a laminar flow hood like he does. And he probably should be also wearing gloves and probably also a mask, but this is probably a pre-pandemic picture showing that pharmacists prepare, manufacture, and check intravenous medications. One of the other critical things that pharmacists do are responsible for is also the storage of medications. You'll recall when the COVID vaccinations first came out, the Pfizer vaccine had some very specific and very stringent storage requirements that are not common in your regular pharmacy. And so those had to be dealt with in pharmacies to provide that vaccine and to make sure that drugs are properly stored so that when they are administered or delivered to patients, that they are in the appropriate form that they will be functional. Another thing that pharmacists are very much responsible for is all of the other ancillary products like personal protective equipment, the masks, the gloves, all those sorts of things, which pharmacies came to play to really provide a lot of those. And then lastly, at the bottom, on the bottom right-hand side, you see a pharmacist who's completely gowned up looking at some test tubes. And this is something that's really interesting because It's something that I had the opportunity to do actually as a pharmacy student, and then later on as a pharmacist working in a home infusion pharmacy, where this is actually a part of the quality control. And what this pharmacist is doing is she's taken samples from around the room where drugs are manufactured to make sure that the environment is truly sterile. And this is checked daily, as well as temperatures of freezers, temperatures of refrigerators, room temperatures. Those sorts of quality measures are very important for pharmacists to manage. And some of the other things that pharmacists do as a result is that they are in various settings. Pharmacists are, of course, in the community as either independent pharmacy store owners or store pharmacists, or in retail settings or chain settings where you've got your Walgreens, your CVS, those types of places. Those would be considered community pharmacists. Clinical pharmacists is an interesting, slightly divisive term in the profession, in that all pharmacists really should be clinical pharmacists, but that's referring to pharmacists who are inpatient, who are in health systems. So pharmacists who are at places like Kaiser, or pharmacists who are at places like hospitals and medical centers, where they're part of a health system. And this health system may have an inpatient setting, they may have a clinic setting or ambulatory care setting, but overall, these pharmacists are part of this health system, right? Consultant pharmacists are often pharmacists who have their own businesses on the side. And a lot of these pharmacists work with long-term care facilities to evaluate medication use and make recommendations on medications in skilled nursing facilities, or what used to be called nursing homes, or long-term care facilities, because legally a pharmacist has to go in periodically to check to make sure that if half a tablet is supposed to be administered, that the patient's actually getting half a tablet, however many times a day. So they go in and they meet with the nursing staff, they review the medical administration records, they look at the patients, they double check whether or not patients are needing lab tests that are behind, and they work with the physicians in these facilities. I'm excited to talk about pharmaceutical industry, which is a booming area for pharmacy. One of our alumnus of KGI came back last week, and she was talking about how she works for a pharmaceutical firm, and they're looking for more pharmacists. They can't get enough pharmacists to work there as medical science liaisons and in other areas. So the pharmaceutical industry is an area that is needing many more pharmacists to work there. And the exciting thing about that is that here at KGI, we actually make good on our promise to engage students in the pharmaceutical industry starting in the first year of the program. In the first year of the PharmD program, we have a course that's taught in the spring called Introduction to Industry, PHAR 370, where students actually get to meet individuals who are employed in this industry. They have an opportunity to do presentations and explore options in this field. So this is a big thing. Entrepreneurs, a lot of pharmacists want to own their own businesses, whether they're pharmacies or other types of businesses. It's a big deal, and we need more pharmacy entrepreneurs. And then lastly, and this is not an all-inclusive list, there are pharmacists who are researchers and faculty such as myself who have taken more the academic route, but we're needed because we need to be those who prepare the future generations of pharmacists and to prepare them for the future of pharmacy practice. Now, how would you become a pharmacist? Well, first you'd have to go to pharmacy school, but to get to pharmacy school, there are some prerequisite courses. Our website contains all of the prerequisites. I would encourage you to visit our website. Here's a basic summary of most of them. This is not an all-inclusive list, but if you prepare for pre-med, you're kind of preparing for pre-pharmacy as well, because you've got your general biology, general chemistry, organic chemistry, all with lab, calculus, economics, English, social sciences, and there are some other courses that you will need as well, microbiology and some other anatomy, physiology. Those courses are necessary as well. But You do not need to have a bachelor's degree to apply to KGI. You must have met the prerequisite courses and have gotten passing grades on all of them, but you do not need to have a bachelor's. You can apply without it. Our pharmacy school is a 4-year program of intensive study. There are some PharmD programs that have 3 years, but they don't have summers in those programs. We do have a couple of summers in between, so you do get a little break occasionally in our program, but it involves in our program about 3 years of primarily didactic education, which means in the classroom, and then 1 year of experiential education, and I'd say primarily. And when I go through the curriculum in a few slides, you'll see what I mean, how we do integrate a little bit of the experiential into the first and second years. And then the 4th year is almost all experiential with one didactic course. So it's almost like we flip your proportion of classroom coursework with clinical coursework. And when I'm talking about clinical coursework, I'm speaking of being out in a clinical site, whether it's a hospital, a community site, an ambulatory care clinic, and you're actually there 40 hours a week, a minimum, and experiencing life as it would be as a pharmacist. We also offer other training that all of our students get. All of our students get immunization training and receive a certificate prior to starting the program. So right after the new student orientation, we have what's called an academic prologue. It's held every August. And at that time, you'll get your basic life support training, followed by immunization certificate training, so that you're able to immediately start administering immunizations under the supervision of a licensed pharmacist. We also spend a lot of time doing training in the first year on patient assessment. And patient assessment means being able to take a blood pressure appropriately, knowing how to examine someone's ears, knowing how to examine a patient's eyes and how to use the appropriate instruments, knowing how to give a diabetic foot exam, knowing how to take the blood glucose, hemoglobin A1C, how to advise the patient about using those agents at those particular testing sessions, those types of things at home, how to evaluate a point of care test that someone picks up at the pharmacy. Maybe they're picking up an ovulation test kit. How would you advise your patient how to use those things? We spend a lot of time talking about patient assessment in the first couple of years of pharmacy school. And we also do a few other things. I teach the smoking cessation. And again, as I always say, I'm trying to look for another title because it's really tobacco cessation, because we don't want people to chew tobacco, not smoking it, nor do we want people to vape. So that's a totally different thing. So, I'm looking at that's a very interesting area of agents that are available that people are self-medicating. And then lastly, when we talk about internship in pharmacy, you as a pharmacy student, when you come in, we make sure that you are ready to get your intern license, which means that you have to apply with the state of California for a license as an intern pharmacist. This allows you to work as an intern pharmacist in drugstores, and you need this licensure. So we prepare you for licensure before day one. You're doing this during the academic prologue. All right, and so a little bit of background about the PharmD program at KGI is that it was the first health professions program, and we admitted our first class in 2014. We are so excited about the work that these alums are doing. Some of them have gone on to open their own pharmacies. Some of them have pursued graduate education in the form of residencies. Some of them have also participated in fellowships and are working in various areas, but most of them are all working in pharmacy. And so we're very excited about that. One of the big strengths of our program is our interprofessional education. And what's exciting at KGI, as I mentioned, we were the first health professions program, but after pharmacy started, we started the genetic counseling program. As I mentioned before, the physician assistant program is coming on board, as well as the occupational therapy program. We are engaged right now with some of the faculty in those programs for the interprofessional education with the PharmD students. We have a long-standing relationship with University of California at Riverside School of Medicine. And we host and participate in sessions, problem-based learning sessions with them twice a year, as well as Chapman PA program, Western University Physician Assistant program, various nursing programs. So if you're at KGI, you will have the opportunity to interface with medical students, PA students, EMT students, nursing students, and also the students here at KGI, so that when you graduate, you are ready to engage with other health professions. And lastly, and very importantly, we are accredited by the Accreditation Council for Pharmacy Education. We could not operate a program if we did not have this accreditation. So as I mentioned before, we have in total a 4-year program. And the first 3 years are primarily in the classroom, primarily. They're mostly classroom with some experiential components. And this is where we have your foundational work, pharmacy calculations, medicinal chemistry, pharmacy law and ethics, biostatistics. These are courses, pharmacokinetics. These are courses that are foundational. In other words, you need to learn them first before you start building on them. That's primarily the first year. Then in the first year, your first introductory pharmacy practice experience that is experiential is in the summer of the first year. And that's when you go out to a community pharmacy for 5 weeks and you experience what it's like to be there. In the second year, then we go on to more courses which build on the work that you encounter in your first year of pharmacy school. It's where you take your introduction to informatics course. You start taking a lot of a nephrology course, studying the kidneys, a cardiology course. So you start studying some of the systems. And that continues on through your third year, where you also start taking more experiential courses and you advance to the psychiatric course, the course in gastroenterology, infectious diseases. And then when you finish all those courses, then you advance on to your last year, where it flips, where you have 7 advanced pharmacy practice experiences and 1 capstone course with a board review. Now the NAPLEX is the North American Pharmacy Licensure Examination that is required in the United States for licensure. It is not the only exam that pharmacists must take for licensure. In the state of California, there's also another exam that has some law components to it, and it is called the California Pharmacy Law, Pharmacy Jurisprudence Exam, or the CPJE. But we prepare our students for these exams, and you do not have to pay extra for these board review courses. Our curriculum is based on 4 main areas, and I alluded to this a little bit as I was talking about it. And the first domain of the Center for the Advancement of Pharmacy Education Outcomes is foundational knowledge. That's your pharmacy law and ethics, pharmacy calculations, biostatistics, everything you need to know to start off, to get started to study the other things. The next one is essentials for practice and care. And this is when we start talking about the various types of systems, physiologic systems, like the cardiovascular system, the respiratory system, the endocrine system. And what do you need to know about that for practice and care? What are the essentials? And then how do you approach it? How do you talk to a patient? How do you explain to somebody that they're going to have to change their lifestyle in addition to taking a medication? So learning to approach the practice and care. How do you advocate for the patient? How do you engage them in a discussion regarding public health when you're trying to explain to them why vaccines are important? So these are all of those 3 domains. And then the last domain is very important. It is called personal and professional development. And so it starts with you as a person, that you need to develop your sense of your strengths. And so again, when you enter pharmacy school at KGI, we start off with something called the Clifton Strengths, right? Because we do what's called Strengths Finders, so that you know what your strengths are and that you learn how to utilize them and engage others using your strengths, to lead with your strengths. And then we advance that and involve you with your teams, working with that. and also the professional development piece, how to interview, how to write a CV, what's the difference between a resume and a CV, how would you engage with other members from the healthcare team, how would you engage in a code, classes on conflict resolution, those sorts of things. So this is the curriculum in a nutshell. And you learn all of these things, or you develop them over the 4 years. And domain 1 is primarily the first year. Domains 2, 3, and 4 are pretty much throughout first, second, and third year, and fourth year. So they're not necessarily by year. So you're not necessarily doing domain 2 in the second year. You are, but you're doing the other domains there as well. And so this is another way. I don't know, the 4 columns might confuse you, but there's 1 column for each level or year in the PharmD program. So the P1 year is, these are the courses that students would take in the first year. The therapeutics courses involving the introduction to pharmacy practice, and then endocrinology, followed by what we call a recitation. And the recitation is a time for application. It is a time where you learn how to do a diabetic foot exam because you just studied diabetes, or you learn how to counsel a patient who has thyroid disease on their medications because you just learned about the thyroid disorders in the therapeutics class. So the recitation is a practicum. Clinical skills, the pre-IPI readiness is a course that students take to prepare them for their first introductory pharmacy practice experience. Again, the pharmacy law and ethics, pharmacy calculations, biostatistics, pharmacokinetics are comprehensive foundational courses. And here in the first year, as I mentioned before, is where you have the introduction to industry. You'll get a chance to talk with those who are actually working in industry and find out about the opportunities that pharmacy students and pharmacists have in the industry. And then also, lastly, you'll have a professional development course along with interprofessional education. In the P2 year, it gets more intense. And we add on not only nephrology and cardiology, but also rheumatology, immunology, infectious disease, and dermatology. So there we start emphasizing the systems much more. And recitation, again, to put it all together. Clinical skills will emphasize as well. And then this is where we introduce the students to emerging topics such as pharmacy management and pharmacy informatics. And then again, you see you have more experiential education with the introductory pharmacy practice experiences 1 and 2. Now in the P3 year, again, we continue on with the therapeutics courses. This is where you have gastroenterology, you have oncology, you have psychiatry, followed by the recitation. And now we're preparing you for the advanced pharmacy practice experiences, or the pre-API readiness courses. And these classes, we're focusing on getting you ready for going out into the world and feeling what it's like to be a pharmacist out there. And so we don't want to just send you out. We want to make sure that you're prepared. This is also the year where we start our certificate elective courses in healthcare management, pharmacy informatics, medical and clinical affairs, and medication therapy outcomes. It's where you get work-related experience in these 4 areas. And those are supported by didactic or classroom courses, the certificate elective experience course, and then in the 4th year, the 2 elective API courses are the courses that are related to whichever certificate you select. So students have a chance to select their certificate in the P2 year. And as a result of that selection, it gives them a number of other courses that they get to do a deep dive to find out what it's like to be in healthcare management and take classes such as healthcare reimbursement systems and electronic records management, et cetera. And then you go on to actually do a certificate elective experience, and then you expand that out to your advanced pharmacy practice experiences. And I have all the acronyms at the bottom. And this is yet another diagram of the courses that I just named on the previous slide and how they're spaced out throughout distributed throughout the 3 didactic years of the program, which courses are in fall and spring in the P1, P2, and P3 years respectively. All right, now I mentioned the certificates, and we're very proud of this because it really helps students to get work experience prior to graduating from pharmacy school. Now, in this, students must select one. So you can't graduate from our program and say, I don't want a certificate. You have to select one of the certificates, but your choice is either pharmacy informatics, which has to do with electronic health records, healthcare management, which has to do with managing pharmacy systems, people who want to be directors of pharmacy, et cetera, medical and clinical affairs. This is the one that's focused on the pharmaceutical industry. And lastly, medication therapy outcomes, which is the more traditional route for pharmacists that take, and it's where you take any number of classes in geriatrics or cardiology, specialty classes above the classes that you've already taken. Then students take a certificate elective experience that's related to their respective areas, and 2 advanced pharmacy practice experiences in their 4th year, so that if anyone wants to apply for a job in healthcare management, you'd be asked, do you have any experience in this area, any hands-on experience? And our students would be able to say, yes, I've had 12 weeks experience in these rotations, and these are the things that I did. And so this is one of the things that we really want our students to work on. Part of the requirements for pharmacy students now is also to complete a portfolio, so that you have a portfolio to show upon completion from pharmacy school of the various things that you've learned and been able to achieve. And here are the lists of the courses in the experiential year, the last year. And I mentioned these before. You're taking a community practice course, you're taking a health system practice course, and these are all hands-on in the community. And ambulatory care, which means a clinic or a setting where people are walking around. They're not in hospital. Acute care, which really means an ICU, somebody who is acute with some kind of dramatic. And then any other direct patient care courses. This would be cardiology, urology, nephrology, and then you can take some additional electives that are non-direct patient care. So you have to have a total of 5 of the first 5 list, and then you can take other electives either related to the other courses or the other certificates. And as an academic institution, all I can say is we would not be here if it were not for our students. This is one of the things that's exciting about being at KGI, is that we're very student-centric. And I really don't think I could have enough slides of our students. They're always busy doing things. I'm always meeting with students, and I'm just always impressed with their leadership and the opportunities they take. One of the things about KGI that you will know is that we are a very high-touch institution. It is not uncommon for you to see the president walking around the campus. When you interview the president, you get a chance to have lunch with the president. Our deans are available. Our dean, Dr. Dean Zdanowicz, is very available. I meet with student groups. I'm very involved in professional organizations. And here you see some pictures of our students on the far left side who participated in the West Coast Pharmacy Exchange meeting with the California Pharmacists Association, where they competed in a quiz bowl. We call it quiz bowl. Just a couple of weeks ago, our students competed in another quiz bowl with other students from the other 13 or so schools in California here at the California Society of Health System Pharmacists, and our students came in second. The white coat hypertension flyer is something that our students put on, and they, in celebration of National Pharmacy Week, they are giving their white coats, and of course they're looking to raise your blood pressure by giving you a free energy drink, right? Because that's going to be full of caffeine and sugar and will raise your blood pressure. And if you're younger, that's not a bad thing. If you're older, when you have hypertension, we don't want that. And then on the very last slide, the last image there, you see a student with gloves on. And this is one of our students who's helping train other students how to participate in health fairs. Every week or so, our students go out into the community and do health screenings and health fairs, and they check for blood pressures, they provide health education. They are really making good on our commitment, as I mentioned earlier, to serve the community, to serve the healthcare community. And this is a big part of our education here at KGI. We want our students to be out and active and making a difference in the world. And they're doing it, and they're doing a great job. So some of the experiences, and this is just kind of what we alluded to, is I talked about the introduction to industry. We do have faculty who are involved in research. Our students presented research projects at that recent conference a couple of weeks ago in Anaheim. I already mentioned the immunization certificate training, the smoking cessation training, the professional and student organizations are first in the slide that you just saw. We do have an internship fair to help students if they want to get jobs, where the employers come to KGI. We're having it this year in February, and the students will have an opportunity to interview. So the interviewers will come to us. And the same thing with the career fair, which will be in April, where the interviewers will come to the P4 students who are ready to go out into the world and work, and they will get a chance to interview with these groups. Internships is not necessarily what I talked about before about pharmacists getting jobs at CVS, even though it's a type of interning. But some of our students have done internships with various drug companies. They've been selected in very competitive processes for this, so you do have the opportunity to do that as well. And of course, there are many co-curricular activities that I mentioned: health fairs, immunization days, drug take-back days. Some of our students are involved in various walks and runs to raise awareness for juvenile diabetes or Alzheimer's. They're very active in the community, and they're always looking to do something more. So we're very excited about this. Earlier this year, in this fall, some of our students went down to provide hygiene kits to the unhoused populations in parts of Los Angeles. So our students are very actively engaged in the world around us. And here are some of our former students, and they all graduated by now, these individuals, and they were at one of the meetings at a hotel here. And you can see that they were all really happy, and some of them presented research, some of them participated in a challenge bowl where they answered questions or quiz, and some of them actually did other competitions of clinical decision-making and counseling. So this is a very big part of our professionalism component in the program. I've already talked a little bit about careers and employment on a previous slide. So I guess I'd like to wrap up here with why KGI. This is an excellent program here at KGI, the Doctor of Pharmacy program, for students who are very forward-facing, for students who are not afraid to innovate and try and learn something new. This is a place where you will be challenged, you will be stretched to grow, but we are a very high-touch school. We're very committed to our students' success. And so this is the type of place it is. There are maybe 50 at most students in the class, in the pharmacy classes. So we don't have the huge classes of 200 plus students. And so you will get a chance to know your faculty. You'll get a chance to know your other colleagues, your students. You know, it really is a smaller atmosphere. And so I would say that we have very much a family or community type atmosphere here at KGI. And here are some faces of pharmacy, some very happy faces of our alums who are gone on to bigger things. They are working at Kaiser, they are working at other places in Chicago. And then the students in the middle are getting their white coats at the white coat ceremony, which is during the academic prologue. It is something that's part of professionalism, and they are students in the upcoming graduating class of the class of 22 and class of 23, represented there in the Faces of Pharmacy. So if you would like to apply, I really encourage you. You don't have to be a science major either. You just need to get the prerequisite courses. A bachelor's degree is not required. Experience in pharmacy is not required. It's a plus, it's nice, but it does not preclude you from applying and being successful. And students with strong communications and interpersonal skills are encouraged to apply. If you don't, we will help you develop them. But we want students who are passionate and engaged and looking to do something new and innovative. And so we're very excited about the opportunity to be part of your story as students. So we're not looking for a cookie cutter type of student. Everyone is welcome to apply, and we really embrace diversity in our class and look forward to seeing many different types of students in our pharmacy school. And so we want you to visit us. We want you to log on to PharmCast and find out about our school and apply. Feel free to speak to pharmacists, faculty, pharmacy students, contact me, contact admissions, get involved in pre-pharmacy organizations at your school, and read all you can. I'd also encourage you to get involved and enroll in the KGI prep program, the pre-pharmacy enrichment program, which is offered in summer. It is a 5-day program. This summer, we're offering it, I believe, both online and on-site in 2 different formats. And you'll get a chance to meet some current pharmacy students and faculty. You'll get a chance to do some hands-on types of things in compounding and do a presentation, develop some clinical skills and professional development. And there's also some more background on the application process, admissions requirements, and technical standards. So I can't emphasize this enough. Offered in June and or July this summer. And some of our students have gone on to do residencies at these facilities, and this is just in the last year. And sometimes we've had some students where we have more than one student going to one site. So I think there are 2 at Palomar Health. And then we have students who've gone on to the pharmaceutical industry rotations, and you see them here. They're called fellows. And then you see some students have gotten involved in research. There's a student presenting research at a conference. And here's a stock photo, but we have some students who are involved very heavily in the pharmaceutical industry. And just one update is, in the past, if you've seen from our previous materials, we used to call it the health informatics certificate. Now we're calling it pharmacy informatics because it's more aligned with the American Society of Health System Pharmacists, pharmacy informatics, which is a huge area that we're looking to expand into. We are expanding our work during the COVID pandemic. Not only COVID, but a lot of our students have been contacted by local pharmacies to help administer flu shots, to help out with COVID testing, COVID vaccines. And so we're very excited about the opportunities there that our students have been involved in. And now I'll just open it up for any questions. And I would like to thank you so much for your time and your interest in finding out about KGI School of Pharmacy. Here's my information. Here's Jason Hartfield's information. I don't know if Lexie Beer, you'd want to put your information in the chat, but I just want to thank you for your time and attention during this webinar.
Thank you so much, Dr. Orum. If you do have any questions about admissions, you're more than welcome to email Jason, as is mentioned here, or you can also email admissions@kgi.edu, and we're happy to follow up with you or schedule an appointment with a counselor, whatever you are interested in doing. We're happy to accommodate that and look forward to hearing from you. Thanks so much for joining us.
Thank you very much.